This is Dr. Philip Cordova, and one of the #1 fears when I talk to patients about chiropractic or a potential patient about chiropractic is that it's going to hurt. Now, if you've looked on YouTube, if you've watched videos of people getting adjusted, it looks like it hurts. I mean, how can something pop and crack or have this big doctor jump on them and cause all this extra force in their spine and it not hurt? But crazy enough, it does not hurt. In fact, I've been doing this now 23 years, and I will tell you that each year that passes, I find I need less and less force in order to get that bone to move, and it becomes increasingly more comfortable for the patients. So even when I was brand new, the adjustments didn't hurt. Now, you come in pain, your back hurts, areas are inflamed, areas are swollen and irritated. Just touching it can be uncomfortable, or just getting into the position, just laying face down on the adjusting table can be uncomfortable. So we totally understand that, and in no way do we want to make things more uncomfortable for you or have anything hurt. So we'll have you lay face down after we've done all of our evaluations. We're gonna check it out. I start feeling along the spine. I find the spots that are sore and tender, and then I do the adjustment. I do it really quickly to where just about the time you think it's gonna hurt, it's already over. You may hear a pop or a crack, but that also releases endorphins. The endorphins are your body's natural painkillers. So most of the time there's like this sense of relief, or the sense of they're able to finally relax, or they feel that muscle start to calm down. And then if we're worried that you may get sore later, like later that night or the next day, then we're gonna recommend that you use ice. We may do some electric stimulation or ice here in the office to calm everything back down again. But the tender spots, the stuff that hurts, is just those spots that already hurt. But the adjustment itself is very comfortable. And we also have several different ways we can adjust you. So if it seems like our hands are gonna be too much force, we have a special table that lifts up and kind of drops a bit. That makes it more comfortable, where you don't have to twist or get into a position that you know is going to hurt. Or even less, we can do an activator adjustment, which is a little handheld device that we just kind of click on it. It's a very low force and still gets great results. So if you're worried about adjustments hurting, know that it doesn't hurt. We have lots of different ways we can do it. We're very comfortable, we're very experienced in how we take care of our patients, and we have different techniques that we can help make sure the adjustments don't hurt you.